Hi, my name is Dr. Zubia Noreen. I'm working as an assistant professor at Comstats University, Islamabad. Today, I'm going to tell you about my recent research project, which was funded by ICRMS, BUTIMS, and UNHCR. The title of the project is Prevalence, Risk Assessment, and Spatial Clustering of Infectious Diseases among Afghan Refugees.
Forced displacement or migration is a global issue and results from conflict, war, or human rights violation. It has resulted in displacement of about more than 108 million people worldwide, out of which 35.3 million are refugees. Afghan makes up one of the largest refugee population worldwide. According to UNHCR, there are about 2.6 million registered refugees which are living in different parts of the world. Refugees face lots of problems in the host country, and there are many factors which may contribute towards their healthcare issues, which includes language barrier, housing problems, unemployment, racism, access to healthcare facility, and water and sanitation. Pakistan is one of the world's largest refugee hosting country. There are about 1.4 million registered refugees living in Pakistan, and majority of them are Afghan nationals.
In Pakistan, the burden of infectious diseases is more pronounced because of overpopulation, lack of surveillance system, indiscriminate use of antibiotics, and weak healthcare system. Moreover, hosting 1.4 million refugees has overburdened the already weakened healthcare system, making the country more prone to infectious diseases and outbreaks. So there is a dire need to identify what are the circulating infectious diseases among Afghan refugees, what are the causative agents, and their antimicrobial resistant profiling. Therefore, the objective of this study was to identify the prevalent diseases among Afghan refugees, identify those risk factors which makes them more prone to those diseases, and also to identify those pathogens which are the causative agent of diarrheal diseases, as that's one of the leading cause of deaths among children under 5 years of age. Moreover, their antimicrobial resistant profiling can also help design strategies to control an outbreak. Finally, to identify hotspots or areas which are more prone to specific diseases.
A cross-sectional survey-based study was conducted in Afghan refugees living in villages, camps, and areas in KP Peshawar highlighted in the map. Moreover, the risk factors associated with the infectious diseases were also recorded. A training workshop was held for students and staff before the data collection to educate them to conduct the survey in an effective scientific manner. To prevent biases, moreover, they were educated about their cultural norms and sensitivity pertaining to Afghan culture to create conducive environment for the survey. A structured questionnaire was administered to the health of the household and encompasses 7 parts: socio-demographic data, source of water, sanitation, nutrition, healthcare facility, child health, and infectious diseases. Stool samples from diarrheal patients were subject to culture-based detection of bacterial pathogens such as Vibrio cholera, diarrheogenic E. coli, Campylobacter jejuni, Salmonella, and Shigella. Samples were cultured in selective media, and the presumptive colony was subject to preliminary identification using biochemical tests. Molecular identification was done using species-specific PCR. Antibiotic resistance profiling was done using disk diffusion methods. Our results show that diarrhea, dengue, and malaria was the most prevalent diseases among Afghan refugees. Hotspot analysis showed that diarrhea was more prevalent in Thani and Korachatak as compared to all other sampling sites. Culture-based analysis shows that the most prevalent causative agent of Viral infections among Afghan refugees were pathogenic strains of E. coli, followed by Campylobacter jejuni. The main beneficiary of the study will be Afghan refugees, as the data generated through the project will help develop better healthcare system, policies, and preventive measures for control of outbreaks among Afghan refugees. Indirect beneficiary would be Pakistani citizens, as it will reduce the chances of transmission of infectious diseases from refugees and overall improve the healthcare system in Pakistan.